Hello everyone. In this video we see about basal metabolic rate, that is BMR. Already we know BMI, that is body mass index, which is calculated by our body weight and height. Don't confuse with BMI. It is BM or basal metabolic rate. Let me see in this video. First, energy. In our every action and activity, we need energy. That energy is measured by calories. So, unit of energy is calorie. Apple is measured by kilogram and milk is measured by liter. Like that, energy is measured by calories. It is also converted into kilocalorie and kilojoule. Okay, that energy is where come from? Is definitely it's come from food. We take food, in that food only we got energy. Okay, அப்படி அந்த ஃபுட்ல என்ன இருக்கு? எப்படி நமக்கு எனர்ஜி கிடைக்குது? Yes, every food containing many chemical components which are called as nutrients. They are carbohydrates, protein, fat, vitamins, minerals. All of these 5 nutrients, first 3 carbohydrates, protein and fat only provide energy to our body. Vitamins and minerals do not provide energy to our body. Okay, vitamins and minerals do not provide energy. Then why we take in our diet? Yes, it has a many important physiological role in our body. For example, vitamin A is help for eye vision, vitamin D is help for bone formation. Like that, every physiological role is also done by vitamins and minerals. Okay. 1 gram of carbohydrate provide 4 kilocalories. Like protein also provide 4 kilocalories in our body, and 1 gram of fat provides 9 kilocalories in our body. Okay, for every action we need energy. Today is a holiday. I take full rest without any work. I take rest in a bed. I eat food and take rest. On that day, we need energy or not? Yes, definitely we need energy. We take full rest also, we need energy. Why? Another one example, in a person in a coma stage for a prolonged period, for a 1 year, 6 months in a hospital, he is in a bedridden. So he don't have any physical activity. That person have energy or not? In a hospital routinely they give trips for him, like glucose for energy. Why they give energy to him? As without any physical activity, in our body, that time also we need energy. That energy is called BM or basal metabolic rate. Yes, நம்ம ரெஸ்ட் எடுக்கலாம், பட் நம்மளோட internal organs, liver, kidney, heart, brain do not take rest. ஸோ நம்மளோட ஆர்கன்ஸ் எல்லாம் ஆக்டிவ் ஆகிறதுக்கு நமக்கு தேவையான எனர்ஜி தான் BMR, basal metabolic rate. So BMR is defined as the energy required for an involuntary work carried out in our body. Are you understand? So without any physical activity, some basic metabolism is carried out in our body. For that basic metabolism, we required some amount of energy, that is called BMR. Okay. What are these basal conditions? As functional activities of liver, kidney, brain, lungs, etc. Then secretory functions of endocrine glands present in our body. Then peristaltic movement of GI tract, that is gastrointestinal tract. Through this peristaltic movement only our foods are digested in our body. Then oxidation of every tissues. Then maintenance of body temperature. Okay. So for our metabolism only we have basic energy. So it is common to all person? Definitely no. It differs from every person to person. So many factors influence our BMR rate. So what are the factors? That is gender, body composition, age, body size, sleep, body temperature, endocrine glands, disease conditions, pregnancy, state of nutrition, environment, temperature, smoking, genetics, psychological state and pharmacological agents. Let's we see one by one. First, gender. Even one person, for example male and female, have a same age, same weight and same height, but their BMR rate is differ. Compared with male, that female have lower BMR rate by 10%. 10% is lower than male. Why? Same age, same height and weight. Then why the BMR rate is increased in female? Because compared with male, female have a more fat tissue. In fat tissue, metabolism is slightly carried out compared with other tissues. Then only female have lower BMR rate compared with male. Then body composition. In body composition, like that gender, we have a more body tissues, we have a more BMR rate. So total BMR rate is higher when we have a muscle tissue is higher. Okay, so BMR rate is based on the muscle tissues present in our body composition. We have a more bone tissue, that time we have a lower BMR rate. Next, age. Okay, so in the first 2 years period is called infant. In that period, infants have a very highest BMR rate, because in that time only our organs start to operate or start to function. So first 2 years of the baby, it has a more BMR rate. Later slightly it will decreased in childhood, then adulthood also it gradually decreased. In older age it totally declined. Then only in old person all the organs worked in slowly. So we face many problems in our old age. Then body size. Like a body composition, in body size also BMR rate is directly proportional to the body surface area. We have a more body surface area, our BMR rate is increased. We have less for body surface area, our BMR rate is decreased. Then sleep. As during sleeping time our BMR rate is 10% less compared with normal. But in some person during sleeping time also move there and there, move very fast, that person have a normal BMR rate. So it also depends on the amount of motion during the sleep of an individual. Then body temperature. So in our body temperature also influence the BMR rate. Every 1 degree Celsius is increased in our body temperature, 13% of BMR rate is increased. So definitely during fever condition our BMR rate is increased. Why body temp? What is the connection between body temperature and BMR rate? Yes, during metabolism only heat is produced, then only our body temperature is increased. So metabolism increased is directly linked with the BMR rate. Okay. Next, endocrine glands. As in our body, thyroid gland is a best stimulator of metabolism. So thyroid gland is secreted thyroxine hormone. When thyroid gland secreted more amount of thyroxine hormone, our BMR rate is increased. When thyroid gland is secreted thyroxine hormone in less amount, in that time our BMR rate is decreased. So in hypothyroidism condition, hypo means low, hypothyroidism condition is a lower amount of thyroxine secreted by thyroid gland. So in that time 30% of BMR rate is decreased. In hyper means higher, hyperthyroidism condition, our BMR rate is 50 to 70% increased. Okay, disease condition, we know every disease condition our BMR rate is increased. For example, fever, cancer, burns, hypertension. For any condition our BMR rate is increased, because in that disease condition our immune system is more active to rectify the problem. In that time our immune system secretes more immunoglobulins in our body, so that our BMR rate is increased. Then pregnancy, yes, that is also we know pregnancy time we need more energy. பெரியவங்கலாம் சொல்லுவாங்கல்ல, நிறையா சாப்பிடணும், நிறையா எனர்ஜி தேவை. During pregnancy time definitely we need more energy. Pregnancy period is divided into 3 trimesters. First 2 trimesters BMR rate is increased by above 6%. In third trimester BMR rate is increased by 12%. It is double the amount, because we have a baby that have all organs. So in our body all organs are double. So எல்லா ஆர்கனும் டபுளாக ஒர்க் பண்ணுறதுக்கு நமக்கு இன்னும் டபுள் தி அமௌண்ட் எனர்ஜி தேவை. ஸோ டியூரிங் த ப்ரெக்னன்சி டைம் த பிஎம்ஆர் ரேட் இஸ் increased. Then state of nutrition, yes, diet also plays a very important role in the BMR rate. We take a over food in that time, in our body metabolism is also high, so BMR rate is also increased. We take less amount of food, that is under nutrition, the BMR rate is definitely fall. So everywhere it is increased or less, that leads to tired or any other problem. So optimum nutrition is required for a normal BMR rate. Then environment temperature, body temperature is related with BMR, it's okay. Why environment temperature is related with BMR? As in our environment also influence our body metabolism. So if the environment temperature comes below the normal, that is below 30 degrees Celsius, our BMR rate is low. So in a cool condition, cool climate, we feel very tired, or we feel ரொம்ப ஸ்லோவாக ஃபீல் பண்ணுவோம். பட் இன் அ ஹாட் கண்டிஷன் we are in brisk, நம்ம நல்ல பிரிஸ்காக ஃபீல் பண்ணுவோம். ஸோ இன் அ என்விரான்மெண்ட் கண்டிஷன் the temperature is higher than the normal, that is above 37 degrees Celsius. In our body system BMR rate is increased. Then smoking, as it containing nicotine, nicotine influences our BMR rate by 10%. Okay, then nicotine எடுத்துக்கிட்டா நம்ம பிரிஸ்காக ஃபீல் பண்ணுவோம், பட் இட் இஸ் குட் ஃபார் அவர் ஹெல்த், as definitely it affects our lungs. But smoke எடுத்துக்கிறவங்களுக்கு அது பிரிஸ்காக தோணும், because it influences the BMR rate. Then genetics, as எவ்வளோ ஃபேக்டர்ஸ் இருந்தாலும் family history is one of the major factor, that is genetics. So depending upon the family history, every individual the BMR rate is 10% increased or decreased. It is based on our family history. Then psychological state, it is also more important. So நம்ம எப்படி ஃபீல் பண்ணுறோமோ அப்படி தான் நம்மளோட பாடியும் work பண்ணும். So we are in stress, hypertension or anxiety. In that period in our body, epinephrine hormone is secreted. So in that time our BMR rate is also increased. நீங்களே ஃபீல் பண்ணியிருப்பீங்க, நம்ம டென்ஷனாக பேசிகிட்டே இருப்போம், கொஞ்ச நேரம் கழிச்சு ரொம்ப டயர்ட் ஆயிடுவோம். Because more energy is spent on that time. So after that we feel tired. So during psychological state our BMR rate is increased. Then pharmacological agents, that is drugs. நம்ம டாக்டரே நமக்கு some drugs வந்து நைட் prescribe பண்ணுவாங்க. Because some drugs lower our BMR rate. That example is beta blockers, which is used to treat hypertension. So it decrease BMR rate. But previously பார்த்தோம்னா nicotine and caffeine. Caffeine is present in coffee, which also increase the BMR rate. Okay. Next we see about significance of BMR. நிறைய factors எப்போ BMR increase ஆகும் decrease ஆகும் இதெல்லாம் பார்த்தோம். Next significance of BMR. So BMR is help in the assessment of thyroid function. Then it also helps in the calculation of total energy requirement of a person. So இப்போ நிறைய ஹெல்த் சென்டர்ஸ் இருக்காங்க, நமக்கு டயட் ப்ரெஸ்கிரைப் பண்ணும்போது அவங்க ஃபர்ஸ்ட் கால்குலேட் பண்ணுறது இந்த BMR, தென் நம்மளோட டே டு டே லைஃப். ஸோ BMR கால்குலேட் பண்ணால் தான் டயட்டே பிளான் பண்ண முடியும். ஸோ இட் இஸ் ஹெல்ப்ஸ் இன் பிளானிங் டயட் ஃபார் அன் இண்டிவிஜுவல். தென் இட் ஆல்சோ ஹெல்ப்ஸ் இன் டிஃப்ரெண்ட் diagnosis of diseases such as polycythemia, leukemia and Addison's diseases. Thank you.